No problem, Harsh. Thanks for letting me take some time here. So my name is Craig Clark, business owner in the finance space now for over 13 years. For 13 years, actually 12 years, I always was looking to provide, insurance for our employees. That was just something that cost-wise was always just a little bit over too much where we can afford. But what happened was last year, obviously, we all know that things changed up, and to be able to retain employees, you had to offer, more services. So healthcare is one of the things that we have made a commitment to that we had to put in place. So we were going out there getting quotes for the 13 W-2 employees, roughly about $6,500 to cover them all. At that time, it wasn't even great insurance. It was going to be more like a filler. That's how I kind of looked at it, as a filler. But Impact Health Share rolled around, and we were able to get a $34,000 difference between the other company. We were paying $3,000 a month for all 13 employees and having everyone covered. So that was huge for the business itself, being able to put $34,000 back in our pocket. To help, in other areas of the business, and provide for the first time in over a decade, insurance to or healthcare to our employees. Personally, I signed up myself as well. As an independent business owner, I was paid $800 a month with a company called Connecticut, had a deductible about $8,500. Personally, I was able to get that down to $268 with Impact and have a deductible basically of $2,500. So all around, I was able to save money personally, and then for the business, we was able to actually put it in the business. Now, again, this was something new. So, obviously we wanted to kind of see how it worked, but we ended up having an employee that, recently she thought she had back pain. So she was, complaining about back pain. And I'm like, you have this health share, go find out whatever doctor you want to go to, find out what it is. So she goes to the doctor, and they find out that she has a mass growing in her back that was actually severing her spine at that point. So immediately, like, she didn't even have to go back home. Immediately, they're like, all right, we have to, operate, find out what's going on, get some of that out of there, start radiation. She wasn't sure how it was going to work. She gave them the Impact Health card. They called up to Impact Health. They clarified that everything was good to go. She could they could start whatever the procedures they needed to. After that happened, she got, immediately got a little bit better, but, she was like, her sons were like, we really don't like the hospital that we were at. It was a local hospital in her area. But finding out that she actually had cancer, her sons and her daughter wanted her to have the best care that she can get. So they made a decision that, hey, we want to go to Johns Hopkins. We want you to go to Johns Hopkins. So they made the phone call, because again, there was no network. So they made the phone call to Johns Hopkins, to make sure that if they were accepted. Johns Hopkins called up to Impact Healthcare Share. They told them that everything was good to go. They could immediately get her into Johns Hopkins, and that's what happened. They set her up with somebody to work with. They got her down there, and now she's been getting the best treatment she can get. This is all fairly recently. She's currently going through this now. The bills haven't just started rolling in, as you're probably going to talk about later on. But one of the biggest things that made a big difference for her, mind you, she's a single mom with 3 kids, is that Impact Healthcare was actually able to negotiate all the bills. So as these bills are coming in that she thought that might bankrupt her, she's seeing that they're negotiating, 70%, 50% right off the top. Plus, she's already met, obviously, because the bills are so high. So she already met her yearly. So Impact Healthcare is basically covering everything. And then the prescriptions is another one that you're probably going to talk about. And this is one we just had a conversation this weekend. She's changing prescriptions because they have to test so many different things, like every other week, to see if this is going to work, to see if that's going to work. So she has no idea what these prices are going to be. She just knows that this is whatever they tell her, she has to go do. And, there's a huge prescription discount that Impact has offered as well, which is going to allow her to be able to get the prescriptions when she needs the prescriptions. So all around, we had a great opportunity with this Impact Health Share. That's why we're talking about it. My employee, she's very happy about the treatment that she's been getting and the option to go wherever she wants. And, the business itself, first time being able to offer to our employees was a blessing. So thank you for allowing me to share, Harsh. I'll throw the call back to you.